Welcome to Journal of Cardiac Failure's YouTube channel.
Heart function, not failure.
Heart success.
Mentorship.
And what matters.
We care.
We hope you enjoy the episode.
Hi, I'm Rob Mentz, the editor of JCF, and I'm so glad you've joined us on our YouTube channel for our next episode. Today, I'm delighted to have two guests with us, Dr. Melvin Echols, as well as Dr. Amin Yehya, and we're going to be talking about a really important topic today. This is in the context of a nice paper that Amin just wrote for the journal, focused on challenges of the LGBT community as they experience them in healthcare, and specifically in the heart failure space. So I'll turn it over to Anu to get us started.
Thank you so much, Rob. It's so exciting to be here for our third episode. And thank you to Amin and to Melvin for taking the time out to speak with us today, and also for contributing so importantly to the journal in the past couple of weeks. So maybe I could start with you, Amin. Could you share with us, you wrote this beautiful piece, I think that was inspired by a patient that you came across. Could you perhaps share that story with us and how it highlighted some of the challenges that are unfortunately not unique to this one case in the LGBTQIA community and some of the struggles that they face?
Yeah, thank you so much again, Rob and Anu, for inviting me today to speak about a very important topic that's near and dear to me. Actually, it's all came together because recently we had a patient who has been scheduling and rescheduling her appointments, and it's not a usual practice for her. Finally, we were able to get in touch with her, and we asked her to come to a clinic, and we finally get to see her. And walking into clinic, you can notice that she was very anxious. And when we closed the door and we sat down and asking her what prompted all the change, and she burst into tears, sharing that she's been going through a change in her life, and she started hormonal therapy as part of her transitioning process. And she continued to say that, she's a heart transplant patient, and, she got a new chance in life, and she wants to live her truth and to be happy. And now it's her chance to do that. And she was worried, to be honest with you, that our medical team, that we're not going to be able to take care of her, or going to refuse care, or we're going to be judging her or make fun of her. But she was pleasantly surprised that we were very all supportive, because, we support patients' decision to pursue anything in their lives that can help them with their happiness and improve their outlook on things. So it's kind of interesting how a patient was so scared to approach us, because she was worried that we're going to be judging her, or we were potentially affecting, holding off on treating her because she's going to be transgender. So that's how it all came out, and we were very supportive of the patient, and we were all came together and helped her through the process, and she's doing pretty well right now.
I mean, thank you so much for sharing. And I think that's a good example that shows how those honest and frank discussions with patients can lead to improved care and really help change us, I think, as providers as well. Melvin, maybe getting some of your thoughts as we think and you look at your practice and some of the barriers to care that you've seen individuals that identify as LGBTQ or have heard in communications with other colleagues. What are some of those key barriers that we need to be thinking about that these individuals may experience?
Absolutely. So first of all, I just want to thank Amin for presenting such a wonderful case. This is a very important topic that shows the very complex dynamics of the thought process that someone is going through as part of this population. And unfortunately, there are many, many levels of bias and judgment. I think one of the most important things is the perception that the patient will have based on sort of what he or she thinks of the medical society, or what he or she thinks of their team. the patient-provider trust relationship is very, very important. And oftentimes people don't disclose their full history for fear of judgment. I think overall, we also have a widespread consensus in our society that sometimes it is negative to be a part of this population, which is unfortunate. In some countries, this is actually a crime to be a part of this population and be who you are. And so I think, in general, we need to make sure that we are very aware that people are very sensitive and very cognizant of the environment. And we want to make sure that we make an environment that's as comfortable as possible. And to Amin's point, whenever you support the patient, they feel more trusting and you're able to really take care of them.
Thanks so much, Melvin. I think you articulated some of these barriers to care so nicely. And it's in some ways so heart-wrenching, because at the end of the day, we all as human beings want to feel seen, want to feel heard. And so I think it's so critically important for us as clinicians to be more and more aware of these barriers. So thank you so much. Maybe I'll turn it back to you, Amin. How do you think, we've talked a little bit about the patient, but how do you think healthcare professionals who are a part of this community are impacted by bias, judgment? Do you think that this is an area for improvement?
Definitely. I mean, it all starts with our medical school training, and there were some surveys that were done by the Association for the American Medical College in between 2016 and 17, and they found around 5.4% of medical students that were surveyed belonged to the LGBT community. No transgender medical students were reported, either because they were not represented or they did not even disclose that. And those medical students, they mentioned that they are scared to disclose their sexual identity because they're scared of being mistreated. And a large proportion of them, actually, they mentioned that they were treated differently. They had 8-time risk even of having dropout from medical school, having a burnout, having suicidal thoughts and ideations, and basically having severe depression. And this translates also through not just medical school, but also residency and the work environment, where we see a lot of, challenges there. Medicine has always been considered a very conservative subspecialty or work. And many LGBTQ physicians continue to struggle with the stigma of fear of being discriminated against because of their sexual identity. And up till now, most workplace environments are not very open and supportive of the LGBTQ physicians. There was also some survey which reported that around internists, they mentioned 40% of them noted that there are some remarks made against the LGBT community, including homophobic slurs, which definitely can create an uncomfortable environment to grow and to practice. And there's another, I'm sorry sharing all these data, but there's another survey which noted that around 17% of LGBTQ physicians have reported either denied employment or they affected their promotion in their institution, or even their privileges within their work. And that can basically create a sense of being isolated, sense of helplessness, and can lead to increased risk of, again, mental health problems, including depression or unhealthy coping skills among providers.
Thanks for taking us through that. I think those data that you shared have been so helpful to really anchor this discussion and take us through the impact of these barriers for patients, the challenges that our colleagues are experiencing on a day-to-day basis in practice. And as we think about changing the environment, and I think at the Journal, that's been a big focus of ours. How do we have these conversations, think about change? And your comments are so spot on to help us think through this. Melvin, maybe another question for you as we think about the cardiovascular risks for individuals identifying as LGBTQ. And I think that relates to clinicians, that relates to patients, but what are some of these risks that we need to be thinking about?
Yeah, absolutely. So I was just thinking, as Amin was illustrating the points for the physician, those very same points can apply to patients as well. So many times people who have who are part of this community, who have grown up, may have been bullied. There may have been a lot of societal pressures that have actually caused depression, mental wellness issues, as well as different coping skills. And so we do know that there is an increased risk of smoking in certain populations of the LGBTQ community. And then we also obviously know that there is a higher suicide rate for some LGBTQ members as well. And so that's very important. And so when you think about sort of the risky behaviors, as well as some of the things that we do to increase our cardiovascular risk in this community, I think it's very, very important to recognize that we must have good prevention measures for patients that are in this community. I think it's very important to make sure that as a LGBTQ member, you are following up with a physician or a provider that you trust. Particularly for our trans community as well, there are issues in terms of hormonal therapies that we need to make sure that that you are, getting good therapy for. And so one of the things that I suggest is to find a physician and a provider that you trust, that you feel comfortable with discussing all the aspects of your life, because the only way that you're able to actually sort of heal yourself mentally, physically, and spiritually is if you're able to be comfortable with who you are.
Thanks so much, Melvin. I really love that holistic approach, which is so critical in how we not only take care of patients, but also take care of ourselves, right? It is the mental, emotional, spiritual, and physical aspect of care that are all important. Maybe just in our last minute, Amin, if I could turn it back to you. So what do we do to make things better? Melvin highlighted some of the essentials for us, in terms of prevention, but what can we do better, different now for patients, for clinicians? How can we make change aside from raising awareness as we're trying to do now?
Yeah, I mean, what a great time now we're even having these discussions. Going back 5 or 10 years ago, these discussions were not even held and everything was been not spoken. I mean, this is a great time to build the trust between the community and the healthcare system. It all should be built on allyship and respect, and building this trust, knowing that there is, words matter. We have to look as a physicians and have a retrospective look at our inherent biases. And we should not always assume that, for example, every patient is cisgender or heterosexual. We should learn more about this community, about its challenges. Also, the healthcare system, there's a big role for the healthcare systems, try to work with advocacy groups, nonprofit organizations, and other leaders in the field to try to understand and to help, from the physician standpoint, retaining these physicians, help, hiring them, and also, having zero tolerance for homophobic slurs or any type of, bullying or disrespect to LGBTQ physicians. Also, going maybe backwards during training, medical schools and training institutions should try to nurture an environment built on diversity, inclusion, and everybody is respected. Words matter. We should address people by their pronouns. I can see here, other side, have he, him, his. Everybody has like to be called, specific, different way potentially, and we have to be cognizant about it too. So respect, integrity, communication, and coming all together from medical societies, advocacy groups, healthcare system administrators, all we can work together to make things better. And the first thing, again, talking about it is the first step to make things better. And we thank you guys so much for having a genuine interest in promoting and talking about this topic, because not many people do. And don't know if Melvin, you have any other thoughts about how we can do things better too.
Absolutely. I've known Rob for a very long time, and I must say I am very appreciative of the work and the effort that the journal has taken. You and Anu are just amazing. And, instead of sort of talking the talk, you're actually walking the walk. And this is what it takes: communication, sometimes hard conversations. But over time, I have no doubt that you are ultimately changing the field. So we definitely thank you.
Well, Amin and Melvin, thank you both. This has been an incredible conversation. We've learned a lot, and I know our listeners have as well. I'll draw everyone's attention to the nice piece that Amin just wrote in the Journal of Cardiac Failure. Stay tuned. I know that there'll be much more to come. You highlighted nicely this construct of words matter, and that's been our mantra at the journal, whether really moving from failure to function, focusing on the LGBTQIA community, aligned with our core values at the journal, really focusing on DEI and belonging, and really walking this walk and being a part of this community. So thanks all for joining. Thanks to our special guests today, and we look forward to continuing this conversation. Take care. Until next time. Bye-bye.
Thank you.